It's time for our health segment, and joining us now is Africa 54 health correspondent Lino Mudu with a look at challenges of accessing radiology in Africa.
And that's right, Esther, but first we start with teenager and exercise. The first ever global trends for adolescent insufficient physical activity show that urgent action is needed to increase physical activity levels in girls and boys 11 to 17 years old. The study, published in the Lancet Child and Adolescent Health Journal and produced by researchers from the World Health Organization, finds that more than 80% of adolescent students worldwide did not meet current recommendations of at least 1 hour of physical activity per day, including 85% of girls and 78% of boys. The study, which is based on data reported by 1.6 million 11 to 17-year-old students, finds that across all 146 countries studied between 2001 and 2016, girls were less active than boys in all but 4 countries: Tonga, Samoa, Afghanistan, and Zambia. The authors say that levels of insufficient physical activity in adolescents continue to be extremely high, compromising their current and future health.
The WHO has been really working to promote activity in this area and produced a very nice guide on the strategies and policies to be active. For this age group, I think the solutions are about promoting activities that appeal to young people, engaging them in determining what kind of activities they'd like to be doing, improving urban design to encourage the urban spaces that are needed for young people to be active, improving the security and safety so that young people can be outside. And then in schools, of course, for this age group, a lot could be done to promote physical activity in schools, physical education, or just opportunities throughout the school day for young people to try and get this 60 minutes of activity that's needed.
And according to the report, the health benefits of a physically active lifestyle during adolescence include, among other things, improved cardiorespiratory and muscular fitness, positive impact on weight, cognitive development, and socializing. And many of these benefits may continue into adulthood. Now, radiology is recognized as a key component of modern healthcare. X-rays and CT scans are critical to diagnose and treat a variety of diseases. However, according to the WHO, approximately 3.4 billion people are at risk for widespread losses and death that can be avoided or treated if radiology were available. Dr. Frank Minja is director of Neuroradiology, MRI, and assistant professor of Neuroradiology at Yale University. He discusses the challenges of access to radiology in Africa and how they can be addressed.
So radiology is a branch of medicine where we actually interpret any medical images. So there are many ways of taking pictures of the human body. So X-ray and ultrasound are probably the most common ways that people have heard about. But you can also have CT scans and MRI scans. But basically all of these technologies are a way of basically looking inside the human body and being able to diagnose diseases. And so what the radiologist does is basically interprets those pictures. So once the pictures come, we train to actually look at the images, interpret the images, and basically try to decide what kind of disease, for example, whether a person has a fracture, or whether a person has cancer, whether the cancer is responding to treatment, or whether a person has an infection, and so forth.
When does someone need an X-ray as opposed to an MRI versus a CT scan? How do you differentiate that?
Absolutely. So it really depends on how the patient presents, meaning like what symptoms do they have. And the other thing is that these different technologies have different strengths. For example, X-ray is very good about detecting fractures. So X-ray and CT, even CT scan is an X-ray based technology. So those technologies are very good at detecting problems with the bones. So if somebody had trauma, whether it was a motorcycle accident, CT scan and X-rays are very good technologies for that. For example, if it's more of a soft tissue, so let's say you're worried about somebody having cancer, somebody having infection, or somebody wanting to check their pregnancy and seeing how the pregnancy is progressing, ultrasound and MRI are far more suited for that. And the other point is that ultrasound and MRI do not have radiation. So when we are worried about exposing the patient to radiation, especially females who are pregnant or younger children, we'll prefer to do ultrasound and MRI and sort of spare them from using the radiation that is delivered by X-rays. So it does depend on the patient population and what the clinical question is.
When you look at how far medicine has gone with radiology, and you working in the United States, of course it's available, but as an African, what can you tell us?
So unfortunately, in the African context, things are still quite dire, and I would say that we were struggling a lot with the availability of the technology. So beyond X-rays and ultrasound, the CT scans and MRI scans are actually quite expensive, and so most countries, hospitals may not have the facility. But I would say the even bigger problem is the lack of trained specialists. And that is an area that I have a lot of passion about. So Tanzania specifically, we have only 70 radiologists for a population of 60 million people. So literally you're having about one radiologist for a population of 1 million people. And that is clearly not sufficient, where the recommendation is close to about 100 radiologists for a population of 1 million. So we have like 100-fold to go. And so I would say many countries now are beginning to understand that the machines and the technology needs to be purchased, but still we are lagging far behind in training opportunities and training of the specialists. And we have a lot of efforts to try and address that specific need.
You studied to become a specialized radiologist, but is it something that you can train even a nurse to know the basics?
This is the issue about whether we can do task shifting. So I think at very basic studies, let's say the X-rays about fracture and so forth, you may be able to train non-MD physicians to do that basic interpretation. But once we start to get into what we call cross-sectional imaging, which is the CT scans and MRIs, I think you need a certain level of expertise, and it wouldn't be helpful to train all medical cadres to interpret those images. And even here in the United States, where we have the capacity, they're still interpreted at a pretty high level, and people need the specialized training for it. So I think there is a role at the basic level, but once you start getting a little bit more advanced, I would advocate for more specialized training programs.
What work are you trying to do in terms of bringing back to the continent, particularly in Tanzania?
There are still many, many opportunities in terms of providing the services. So, for example, radiology, we're fortunate that the images are digital and they can travel. So, meaning the same way on WhatsApp we can share pictures, there are platforms for us to share medical images electronically. So I think, like, for example, Africans in the diaspora may be able to lend a hand in actually providing the service. And many times I will be asked to consult and give like a second opinion on the images. And so we're happy to do that. So I think that avenues for provision of the service, whether it's pro bono basis or whether building what we call teleradiology platforms and investing in those to sort of stopgap that measure, meaning a patient has the CT scan performed in Tanzania, but somebody anywhere in the world would have access to interpret and offer an opinion on that or a second opinion on that. So I think there's bridging between the service provision and the training aspect. So immediately, yes, we can offer more in terms of service provision, but I think long term, we do have to offer training opportunities.